Welcome back to this episode of the Strong Kind Podcast. This episode is with Alex Gamble. Alex Gamble is a physician who is trained in psychiatric and palliative care. We talked about a lot of awesome topics on this podcast. We talked about the human mind, depression, anxiety, how Alex helped me through a period of depression and anxiety, and frankly, a lot of fear in my own life. He's very compassionate. He's a very good listener. We talked about death, fear, training, all sorts of good stuff on this episode, and I really think you'll enjoy it. So check it out on YouTube or wherever else you get your podcasts. Really appreciate Dr. Gamble for being on, and I hope you enjoy it. Peace. I'm starting it up because, gosh, I always get like the first like 3 minutes of like this interesting tangential story because like I just want to talk to people. Like that's really the goal of this podcast. Like
Cool.
uh but you were talking about how you flip-flopped your bookshelves behind you, which if you're
Yeah,
watching this, you can see that because the one that you can't really see, which nobody can really see anyway, Gamble. uh
totally.
the one that is not like facing us is graphic novels, and this other one that we can see is more like probably what you would consider like your educational, your nonfiction type of stuff, right? But like you mentioned cognitive load and working and being honestly like an intellectual, and I think this is where I want to start because it's actually really helpful,
Cool.
is how cognitive load and how just like I don't even know if I would say like social media, all this stuff that just kind of sucks away at our energy that we really don't think about being like an energy suck, um, like is affecting us. Dude, I did manual labor at our Mary's family cabin in Montana, and it was hard physically, but mentally amazing. And I think that's something that's missing from a lot of people. Do you see that? I mean, you're also like, let's just give me your brief CV before you start too. Tell me who you
Okay,
are.
cool. Yeah, so, I'm Alex Gamble. I am a, physician. I trained in, first combined internal medicine and psychiatry, so I'm board certified in internal medicine, which just means general adult medicine, adult psychiatry, and then I did a fellowship in hospice and palliative medicine. I'm now at Stanford, where I work with both the inpatient and the outpatient, teams, just doing exclusively palliative care, that I think about as being informed by those kind of earlier trainings. And could talk more about my experience after training. I worked in rural Missouri for a few years, and back in Kansas City, which is where I'm from, for a couple years, and then came out and joined down at Stanford a year ago, to try to pursue my interests in, getting more involved in teaching and trying to help bring psychological and psychiatric elements of care more deeply into the field of palliative, because those aren't necessarily as kind of well known inside of that space. So that's my ultra brief version of my bio. We can pick apart any of that will be relevant to the discussion. But I want to jump back to your question because you asked about cognitive load and work. And my moment of reflection for this, I had a really interesting experience that was super cool back in Kansas City. So after leaving my last job and before starting at Stanford, I had about a year off. Was in a really fortunate position to be able to kind of take my time and think about what I wanted to get into next. And a friend, my friend Helen Joe, is a genius pastry chef. Her husband is a brilliant executive chef there at the Hotel Kansas City, or Town and Company in the Hotel Kansas City. And Helen, we were hanging out and talking. I was like, "Oh yeah, I've got kind of a lot of free time right now." And she was like, "Oh well, the banquet kitchen team, so the restaurant team that does events for the hotel, like weddings, receptions, whatever." She's like, "They need people." And my immediate thought was like, "Oh, like what if someone saw me? What if Dr. Gamble was seen working in this kitchen?" And noticing that was my thought, I was like, "Oh, sounds like you need an ego check, bro. Like,
Yeah.
do you think you're above this? Like, what is like, where are we at here?" So I went and met with Helen and got to meet the team, and they were super nice. The other part of that, I think, was like I'd had not a ton of experiences in service when I was younger, but they weren't great.
Yeah.
So I had some hesitancy about like, what's this going to be like? Like, I don't really need to do this work right now. But I was like, well, if it's not cool, like we won't do it. And everybody was super cool and they were really welcoming. And it was such a crazy departure from the work I normally do, like as a physician in palliative care, where like I just sit down with people and am either addressing like really tough symptoms they're struggling with, like pain, nausea, shortness of breath, existential distress, emotional distress, anxiety, or like helping them navigate like literally life and death decisions or like these kinds of challenging things, to then switching to work where it's like, I don't have the skill set here. Like I like to cook at home, but I am not a chef. Like that is not my forte. That is not my expertise. But then the style of work. And I've taken the long way around this answer, which was one day, so I would go in there and he would either do prep work or help with like an actual event, like getting stuff plated for people's wedding. Completely different style of work in many ways, in some ways like interesting similarities. But I remember one shift I spent like 4 to 6 hours just cutting hard-boiled eggs in half and scooping the yolks out for like 1,000 deviled eggs. And I remember just like noticing my mind wandering while I was cutting these eggs. And like the eggs were cold, my hands were getting like numb. And but just like noticing my mind wandering, I was like, oh my gosh, like how cool is this to
Yeah.
do work where my mind can wander and drift? Like at my normal job, I have to be 100% focused 100% of the time.
Yeah.
Your mind can't wander, or it's a major problem. Like if somebody's telling you their deepest thing and you're trying to help them process that, you can't stray and like lose the thread of what we're talking about, right? I can't zone out during the important part of like getting the history on their pain to understand what it's about. And
Yeah.
like being able to do stuff where you can kind of like zone and wander, I think it's like really helpful for your mind. I feel like the same thing happens in training, like going for a run, like doing stuff in a workout where your mind is able to wander, like while your body is engaged and just kind of notice, like that can be such a powerful opportunity, like for stuff to get uncovered, you know? And so like figuring out where can your mind wander, where can you get into your creativity, where can you get surprised, you know, where you're not just like chasing your mind in the narrative that you've locked it into, like at any point in the day.
Yeah.
Um,
Yeah. Well, it's a tremendous amount of pressure that you probably place on yourself, right? To be in the moment, which is it's good, like that's I always go back to like if you've ever watched The Last Dance, which is like the Michael Jordan and the Bulls 90. I love that so much. But like Michael Jordan's superpower was his ability to be super present,
mm,
right? But there's also a lot, there's a balance of yeah, like when that's kind of why I'm enjoying running again and I stopped running, which was dumb. Like, but running is just like it's very, especially like chill running. Like you can just zone out. And actually you probably run the best when you're just relaxed. My dog is she just got her hair trimmed and she's barking and stuff. So
that's
that's what
cool.
you
All
hear
good.
people, but like just zoning out and still moving and breathing, super powerful. Just letting like your body do what it knows how to do, super powerful. And then you have that with contrasted with like lifting like a heavy weight requires a tremendous amount of focus while still kind of being relaxed because you're not going to perform well if you're like scared, right? Or there needs to be a little bit of anxiety in that moment, right? So that's like a really good. I mean, I kind of tie everything to like lifting and training to some extent because it's kind of my analogy for life. But like the juxtaposition between you cutting deviled eggs as a multiple, like multi board certified physician who is honestly dealing with the problems that like our medical system isn't really set up to deal with, which is like really high amounts of complexity that is more associated with our existence. And we're going to get into death here a little bit. That like and you chopping or cutting deviled eggs and just being able to just be like this is enjoyable, right? um and both are like very uniquely human. So my question then, like, because we might as well just take it here early, is what what drove you into, or what made you want to become a physician, and then what has kept you like moving in the path that you've gone down?
Oh man, you know I have my pet theory, my kind of jokey description, because the truth is like I can't really remember at what point I like pointed myself at being a doctor, but it goes back as far as I have memories. Like if you asked when I was younger what I was going to do, like I as far back as I can recall, I remember saying a doctor. My theory is that most adults don't know how to talk to children, and so they talk to them like tiny adults. right? And so like the normal getting to know somebody banter between adults is like, so what do you do for a living? So with the kid, the version is like, what do you want to do for a
Yeah.
living? And when you're really tiny, the list is like, firefighter, astronaut, president. The modern list probably has like YouTuber on it. It's like all the things that you see that like you're aware of. And as you get older, the list starts to kind of narrow down. So here's my theory. If anywhere on your list is doctor and you've demonstrated any aptitude for math and science, there's a cohort of people like teachers that are like, great, let me push you in this direction. And so by the time you're like 12, you've probably answered this question like thousands of times to different adults who don't really have any stake in what you're doing, but you've kind of pledged yourself to this thing by just like saying over and over, like, I'm going to do this,
Yep.
whether you know what it is or not, right? Like
Yep.
I was in medical school and I don't think I could have, I was probably a couple years into med school before I could have even told you what an internist was, right?
Yeah.
Like what is like internal medicine is just kind of a weird anachronistic term. And like, what does that even mean? So I think I got down that route through that kind of general frame of like wanting to help people and like being a good student and like being encouraged in that direction. I'm really fortunate where, I was able to get on that path. It's a hard path, was able to be successful on it and then like actually enjoy it. Cause I've seen people, I knew people who got to med school and then that was the first moment. Like you have to be in many ways so locked in to succeed because there's tons of things trying to push you out and like whittle you down that you're like, you've got to fight. That there's often not a lot of opportunities to even think about like, what am I doing? Like,
Yeah.
does this make any
Yeah.
sense for me? Like, where am I? And at the points that I picked my head up, it was like still making sense, or like there was kind of a reason. And I was fortunate to have like good guidance and mentorship to help me find like the reasons to be connected with, right? Like I'm a big proponent of that notion that like if you have your why locked in, how is just a matter of time. Like you'll figure out how to get there if you know why you're doing it. And so I think like those kind of early things of just like, yeah, like how can what's the thing that I can do to help people? I watched like ER a lot, like I was super into like
Dude.
medical shows when I was younger. So I feel like that context is also like really important. So yeah, and then it's like, okay, so now you're in med school, like what are you actually going to do? And I for this part, for how I got to like palliative care, first it's why did I do combined med psych? Because that's really rare. There's like on average, I haven't checked the count lately, but usually it's like 10 programs in the country that most of them only take like 2 people a year. It's like very niche to do like this combined training. And for me, it was going through the hospital and seeing that people with psychiatric issues, they didn't just stay on psych wards. Like they were everywhere in the hospital, and
Yeah.
their mental health issues, whether that was like depression or schizophrenia or a personality disorder, like really made it hard for them to get good care. Like a lot of times the best they could hope for, if they're in there with like kidney failure or heart failure, and they have like major mental illness alongside of that, the best they could hope for would be to be in the hospital on a general medical ward with like a psychiatric consult team following to like offer additional insights and like help with guidance, but that's still kind of fragmented. And
Hmm.
so my sense is like a little, doctor to be was like, well, this we could do better for this. And that question was on my mind because I was trained in Jesuit schools, from like high school to college to med school. And so Jesuits are like I describe them as like the hyper liberal wing of Catholicism,
Yeah.
where they're super dedicated. They have what they call the preferential option for the poor. And the idea is that we have a special duty and responsibility to serve people that don't have an advocate. And so for me, it was like, well, this is that group of people, like
Yeah.
people who have medical and psychiatric issues, like they're the most vulnerable in the system. They're having the hardest time. What do we do how could that be better? I didn't have a notion of like how that could be better. And I was really fortunate to have a mentor in Anjan Bhattacharya, who was med psych trained, who was able to like help me develop a vision around that and was very encouraging for me to pursue that kind of training. When you do med psych, the question is, what are you actually going to do with this? Because most systems aren't set up to like really work with somebody at that like verge. I trained at Iowa at the University of Iowa, which is where you and I met. And that's an incredible place because they have a med psych unit, which is a dedicated unit for the care of people with both medical and psychiatric comorbidities. And the thing that really makes it run is the staff that are there, because like they can handle everything, like medically ill patients, psychiatrically complex patients. Like it's an incredible place to work, but there's not a lot of places like that exist. And so I got exposed to palliative care and saw like, oh, this is an incredible um, hinge point for these two skill sets, because palliative care is care for people with serious illnesses like cancer or heart disease or neurologic illnesses that focuses on like improving their quality of life as much as possible. So we help with managing, like I said earlier, tough to manage symptoms, help with communication, coordinating care, like help them understand what's going on, and make sure that their personal goals and values are at the heart of the plan that's being put together for them. So it's like an extra layer of support that's there to like make sure you know what's happening and advocate for you. And that I was like, oh my gosh, like this uses my whole like the medical side of my brain to translate that information and make sure that it's accessible, and also like to help with the planning piece, dealing with the physical symptoms like nausea and shortness of breath. And then of course, like people in that setting are going to have a profoundly complex emotional experience. There's going to be interpersonal challenges, right? Because like if you're going through this illness and you're making decisions, your family's impacted by that too. And how do they define family? How do they communicate? So all those psychiatric and psychotherapeutic skills, I'm like, this really lets me use my whole, goofy med psych brain. And then the other thing I saw was like, you're just getting called to crises that often reflect system failures.
Yep.
And so there's also like a really cool opportunity to be an advocate for helping systems get better. And then like
Yep.
being able to help improve the care for many more people than I could ever actually just see one-to-one at the bedside. So that's the long way around how I got to where I am, like why medicine. I think this, naive, underdeveloped sense of like, I want to help people, and then like going down that track and trying to find my way. So I feel really fortunate because I really love the work. It's incredibly challenging and it's incredibly rewarding. Like we have an opportunity to really meet people who are in crisis in many ways and help them find their footing and get back to the important work of living their lives,
Mhm.
in the time that they have, even if it might be limited, even if there's uncertainty that's there, like just really trying to help people navigate a really challenging space and a difficult system. Navigating the modern American healthcare system is its own kind of challenge.
Yeah.
So
It's a
yeah,
giant
it's
one.
yeah. But my mind doesn't get to wander like when I'm cutting deviled eggs,
Yeah.
So
Yeah.
there's different benefits to it and also different costs to doing the work.
Yeah. 100%. I mean, I think humans are super interesting. So, like one thing that helped me is, realizing that like I basically have like this kind of cognitive and spiritual energy that like gets zapped via intellectual work. And
Mm,
what often helps me with that, like yesterday, I felt my brain was just mush. And I like went and that's a big part of the physical component is because the physical component you kind of prove to yourself, even though you feel like crap, you can still like do something. And that's why I'm such a huge proponent of moving your body. And because it doesn't you still need to go rest like you still need to sleep, right? Like I'm honestly a believer in like you can't grind your way out of like a lot of people's problems are this like weird grind mindset, and like you have to work hard. But everybody that I know that has like achieved what they want, they have also figured out a way to manage their time and their energy in a way that sustains them for like a longer term approach.
mm.
And that gets very lost in just our culture. The American culture is just very much oriented around speed and like somewhat like the grind mentality, and like speed's important. Working hard is important, but also like nobody else in the world really, or a lot of other places in the world, especially where places where like people are kind of uniquely happy, emphasizes like the rush that we do, right? But to go back to, okay, because palliative care, the word palliative scares people because it's like,
Mm.
oh, you're gonna die, right? Like this is just for people who are like, but what does palliative mean? And why, like, and what are some misconceptions that people have where it's like, actually, this is very much a positive. It is a super important aspect of people's care. Um,
Yeah, yeah. So the word palliative comes from a Latin term, like most of our good, $10 words in medicine, that actually just means to cloak or to cover. And so I think it's like very evocative of like, trying to offer comfort. Like let me wrap myself around you. Like how can I help you in this moment? You think about somebody who's out exposed in the elements, like having a covering to give you a sense of warmth and safety can like be really helpful. And so I think that's like a beautiful evocation of I think what we aspire to in the work is like, here's this person who's exposed, they're vulnerable, and can we wrap ourselves around them so that they can feel more secure? And I think, in my estimation, it's like so that then they can continue on in their journey, right? We're not trying to swallow them. We're trying to help them, get some sense of stability and move forward. Um, and yeah, our field definitely suffers from some marketing issues. That there's definitely a conflation in the terminology or those things that are there. We also, since we're dealing with people with serious illness, like death is there in the background. And we have, you talk about our culture and kind of like grind set, but also we have a really deficient culture in many ways around, talking about what life is and how it works.
Yeah.
That like there is a life cycle. It has our life has a beginning and a middle and an end. And that's part of that big picture. But, with our don't want to divert too far into like modern consumer capitalism, and the place our focus is not just on going fast, but on like, being young and sexy and powerful, and not appreciating that like, each of those stages of life has its graces and has its wonderful things, right? Like there's something wonderful about babies and about toddlers and about childhood. And there's something wonderful about adulthood and productivity. And there's something wonderful about the late stages of life too. And it's complex because, our end of life journeys are going to look unique to us depending on like what life throws our way. But that's also like something that's like really interesting and wonderful. And I think on average, like we don't talk about a lot. So coming back to the question of palliative care. So yeah, the way that we define it again is that it's specialty care for people and their loved ones dealing with serious illnesses. And if that feels vague, it's because it's really broad. Like we're
Yeah.
really there for anybody. We say at any age, at any stage, and no matter what the goals are, right? So from the time you get a diagnosis, right? So say I get diagnosed with, a cancer, right? It might be caught at an early stage where the goals of my treatment are to cure me. Palliative care can still be really valuable to me, even alongside my curative intent treatment, because the treatments I'm going to go through might have really intensive side effects that my oncologist is going to work on with me, but they might be really difficult and complicated. There might be other stuff happening in my medical history that makes it hard for them to really get on top. Having an extra team of people who have expertise in managing the side effects of treatment and symptoms can help put me in a better space to get through that journey where I'm able to stick with the treatment that's hopefully going to cure me. You know, receiving that diagnosis can feel really threatening, right? It might be the first time I'm making contact with heavy existential questions like, well, I am going to die.
Yeah.
Pretty much all of us to some degree live in denial of that fact. And so getting a diagnosis sometimes is like the first thing that punches through that like barrier that I have between myself and that reality. And that can be really confronting. If I haven't spent time around those questions, I can get really disoriented. I can get super distressed and it can really break me out of the flow of my life. And so having people who have done that journey a lot of times, have a lot of reps, right? Like having that conversation to come find me where I am. If I'm lost in the forest of fear in my mind, is this a team that can come and find me and help me make my way out so I can get back again to my journey of living and doing those things? So, our work, it's not just physicians like me. We've got medical providers, whether that's advanced practice providers like nurse practitioners, physician's assistants, physicians. There's social workers on the palliative care team. There are spiritual care providers on the palliative care team. There's nurses. Again, depending on the team, there might be other members as well. But the idea is that you've got people with expertise that looks at the whole person, right? So it's a holistic model of care that looks at every aspect of your well-being to see like where are pieces missing, right? Like, are you having trouble getting care because you don't have a ride, right? Like, our social workers are incredible at knowing like what are the resources that are out there. Are you having trouble going because you feel so anxious about it? Again, like our social workers have an incredible skill set at like helping people process emotion, right? And our providers also have developed those skills as well. So we work together as a team to try to meet you where you are and try to keep you in the flow of your living and get through that journey. So if the focus of your treatment is to help you get cured, we want to support that. If the focus of your treatment is just to try to extend my life, I have an incurable illness, but I'm trying to live longer with this because there's important time-based goals I want to get to, right? I want to be there for the birth of that baby. I want to be there for that wedding. I want to finish my book, right? Like, okay, let's do what we can to help you get that time. If everything is off the table, there are not things that can cure me. There are not things that are going to meaningfully extend or prolong my life, or I don't want to go through that anymore, which like we could talk about that decision-making process. I still want to be comfortable, right? I still want to enjoy all the time that I have left. So palliative care, again, is think about it as an extra layer of support with a robust team of experts that are going to look at your care from every angle to support you on this journey with this serious illness that's going to impact your life in ways that can be hard to predict. But the focus is, again, supporting you so you're as comfortable as you can be. I think about the symptom management piece as like we're giving you your energy back.
Yeah.
If you have uncontrolled pain, that's energy out of your
Yeah.
battery every morning you wake up that is going to be blasted on just like, oh my God, how am I going to deal with this? If we can get that pain under better control, that's energy you get back to do something that's more important to you,
Yeah.
like spending time chatting with your buddies or playing with the baby or watching the TV show or going for a walk, reading the book, like whatever it's going to be. So our focus is on maximally improving quality of life through expert symptom management, communication, and coordinating care.
So let's talk about pain because pain. So, dude, when and I'll touch on this and ooh, that's my screen. Sorry,
Okay.
some notification, but so like I'm a physical therapist. I also like was I was pre-med. I wanted to I like you. So here's what my trajectory of life was. I just was the kid that like I kind of intrinsically knew, and I should probably change this belief, but like I was never gonna be like the star, right? I'm a role player, right? And but like I wanted to be a Navy SEAL. September 11th happened. I was like 11 years old. I saw those guys on boats like immediately. That's when, like, and then I heard like these dudes are like the most badass dudes there are, right? And I so I'm like, I'm gonna do that. And I told everybody. And then I got to like 19 years old, and my parents and I talked to recruiters, my parents were like, no, like go to college, like be sensible. Like we didn't have a military pedigree, and that's okay. And I was like, I'm still gonna do it. So that's where physical training started. It was like I'm gonna get physically prepared. And then I just kept kicking it down the road. I was afraid, right? And this is the hard part about just going back to our earlier discussion about like people doing stuff without really you can't change the past or anything like that, but I decided like I just kept kicking it down the road until I was like 28 years old, and then it's basically like you're kind of too old, right? And then I had like I still had the desire to like do something hard, and that was what became like medical medicine, because I kind of have always associated like doing the hard thing is the good thing, or it's gonna elevate you, right? And
Hmm.
I think a lot of people do that with a lot of things. Um, and it's not bad to, it's obviously it's a good thing to do hard things, and but it's like how you define yourself, right? And
Hmm.
I so me and you connected at a gym in Iowa City when we were younger, and then and when I was it was 2020, so there was a lot going on, but I was 30 years old, like pretty freshly married, like a year and a half into marriage, which marriage was good. But like COVID hit, and I was seeing grief and suffering, and honestly older folks literally deteriorating in a matter of like 30 days. People's mental health, like I'll just say health, but like people with early onset Alzheimer's, I will say like very quickly deteriorating because of a lack of socialization and a lack of normal daily activities. Um, and I like started to like feel emotions that I had never felt before. Right. And so, and then I had like physical pain. Like that was for a 30-year-old dude who's pretty active. Like I didn't know what was going on, and I started to get really afraid. And Dr. Gamble here like suffered through me like texting him and asking questions, and honestly like moments of me being really low, and you having, like you said, the reps to ask a hard question. Like you sent me a couple messages that just they were not like you're gonna be okay. They're like, Dave, sometimes you just gotta fucking like, like let it hit you. And it hurt, right? But I want to talk a little bit about how complex what we would call pain is, as opposed to just like nociception, because nociception is like a noxious stimuli. It's almost like I would consider nociception, if you want to get into the weeds here, nociception is just honestly kind of like tensile load. It's like there's some form of like, it's like a something with a tissue is affected, which can be good or bad, because like lifting weights is kind of painful in a very small way, but you learn to deal with it. Whereas like pain is this complex thing that is physical, mental, emotional. It's really like, it's just very human. But and I know med school doesn't necessarily do a great job of depicting the cognitive and emotional side of pain, but what have you learned in your field about pain and how weird the human experience is? And then how do you help people navigate pain besides, I mean, and the medications and that type of stuff is a big part of that, right? But like there's also, you said like the comfort factor of being supportive and that type of thing.
Yeah, for me, I've learned a ton. I've learned a ton about pain from the people that I work with, from the patients that I see, in their experience of their pain, because it is, I think, as you said very well, like it's a when we talk about separating pain from the sensations in our body, right? Like when we talk about pain, because we'll also sometimes talk about like pain versus suffering,
Yeah.
and we'll identify pain as like the primary sensation that we're having in our body, and suffering is being like this cognitive layer above that, where it's like, what is the story that we're telling ourselves when we're having that
That
experience?
was the message you sent me, is I was experiencing multiple things in my body that I frankly did not understand.
Yeah,
And you're like, dude, read that back. Like you're telling yourself a story and
yeah,
you're suffering. And I'm like,
yeah.
damn, that was it didn't. I think I went and cried in my car, but I mean it's probably what I needed to do, right? But
Yeah,
anyway.
yeah. It's just to
So
sit with it. Yeah. And I have to say, Dave, I wanted to just touch really briefly on, getting those texts from you at that time. I didn't feel, while I'm sure I was relying on skills that I learned in my training as a doctor, like my feeling in getting those texts was a feeling of like of recognition,
yeah,
because I, like, in addition to being trained as a psychiatrist, like I have a brain that runs depressive and runs anxious,
yeah,
and I'd started having panic attacks when I was in college, and had, like, I think, a pretty typical experience where it's like I didn't know what was going on. I was just like white knuckling it. After months, I finally went and sought medical attention. The medical attention wasn't satisfying, so I just kind of kept
yeah,
white knuckling, and then spent years like just figuring out a way to kind of manage it
yep,
before like really finding out like what the label is, getting into the fact that like there's a literature around this, and then going through psychiatric training and learning like, what is the Western medicine kind of approach to this question. But the things that you were describing, I'm like, oh, I know what that feels like because I felt that.
yeah,
And I could tap right away into like how scary and isolating that is,
yeah,
and how difficult that is. And then was trying to tap into like what were the points of focus that help wake me up, because you're in a trance, right? You're in that zone of like fight, flight, freeze, fawn, and you're trapped in a story. A lot of what I think about in terms of like the work I do now is like helping people find different narrative threads.
yep,
Like we make sense out of our life and we're pursuing a thread around a narrative. And sometimes, the narrative's working really well for us, so we cling tight to it, and then we forget that we're just in a story. We
yeah,
think this is what it is, and then that rope carries me into a brick wall, and I forgot that it was just one story, that I could let go of that and find another story anytime. And I'm like, oh my God, the wall is everything. I can't go forward.
yeah, yeah,
And
yeah,
and that's a scary place to be. So like for me, I that's like a frame I use a lot with patients is, like, what is it? Help me understand what their narrative is, and then look for alternatives that are close by. So it's
yeah,
close enough that it still makes sense to them, and they can like they can grab a hold of that, and it resonates with what's important to them. So like meeting again, go find them where they are in the forest. So I felt like, in that moment, I could see where you were in the woods, and I knew, I'm like, Dave's got to find his own way out of the woods. I can't carry Dave out,
yeah,
but can I shine a light and that would help him see like, oh shit, I'm just deep in the woods.
yeah.
And like, oh, there's a light that way. Like I could start moving in that direction, when I feel safe enough and I'm able to do that, and
Yeah.
that's how I kind of think about that piece. I feel like
It's
I might have got away from the heart of our question though.
No, dude, it's this is because this is where I want this to kind of go, is
Mm.
because I mean humans, um I probably read more psychology. So the biomechanical aspects of like physical therapy, I really don't think are that complicated. People really latch onto
Well,
those.
I want to stop you there, because I was listening to another conversation you had, and forgive me, I'm not going to remember the guest name right off, but I've heard you do this before, where
Yeah.
you're like, it's not that complicated. That's minimizing your expertise. It
No,
doesn't seem that complicated to you because you got a lot of hours and reps
yeah.
breaking it down. So you can break it down easily, But
Yeah.
for somebody who doesn't know what you know, it's actually very complex for the reason that they lack that fundamental knowledge. And the
I
other
probably need
thing,
to do a better job of like acknowledging that, because it'll probably help me help people understand better, right? Because what my in defense of it, here's what I think we do. We
okay.
tell people we're like, you're a machine, and if you just figure out the biomechanical aspects of
Oh
this
yeah,
stuff,
yeah, totally,
that's my bigger qualm, because yeah, it is
totally,
complicated.
totally.
Or I will say it's hard, but a lot of it's just like it is kind of physics and like leverages, because you said something that's really profound in that I'm actually just trying to give you like a little step as opposed to like of the broader, bigger step. And
Yeah,
that's usually what helping people with like their physical pain is. It's like, hey, I've got pain with running. Okay,
yeah,
can you bike? Yeah,
yeah,
biking actually feels good. All right,
yeah,
that's the step we take for a little while. And then we're gonna
yeah,
retest your running, right? And
yeah.
there's layers to that. But like,
Totally. No, I think that's so that piece, like it's funny because I feel like that really was like I learned that lesson, I feel like at the CrossFit gym.
yeah,
Because I didn't have a lot of experience like as an athlete or in athletics and like being coached in that way.
yeah,
And recognizing that like, having the experience of being coached, and also, it was such a great atmosphere where it's like we're helping each other and like trying to build each other up. But like if you give somebody 10 cues, they're lost.
super.
Like great coaching is what's the two or three maybe little steps from where you are that are going to get you in the next direction. And like that is such an important skill. And it's like it can be really hard. It tests
Yeah.
like your own expertise at breaking those things down.
Well, because we want to validate our ego, right?
Oh
And
yeah,
the
man.
reality of most
Yeah,
of
man.
life is it's like kind of just this little step, and
Right.
taking the little step over
Right.
and over again
Right.
will get you where you want to go, but it
Yeah.
feels slower. But
Yeah.
the cyclical, I posted on the hedonic treadmill today,
Yeah. Yeah.
and that's kind of it's also, man, I think we have savior complex, and
Mm.
this is not any criticism of religion in any way, shape, or form, but I feel like people want the Hail Mary. They want the deliverance
Yeah.
without like just realizing that the actual deliverance comes from like these little steps. And
Totally. And that's and I love that too because it's like those two things kind of reflect each other, right? Like
yeah,
we're describing both the journey of the person who's seeking wellness and the journey of the person who's like trying to help them find their way to it, whether that's like as a coach, as a physical therapist, as a physician. But in both places, like there's a need. It's tough because we're trying to find the balance between like making sure my eyes on the goal, but being present in the work I'm doing. Like the analogy that comes right to mind is like open water swimming, like in a triathlon.
hmm,
Is like I need to look up periodically to make sure that I'm headed toward the pylon,
yeah,
but then I need to put my head back down and just do these strokes. And
yeah,
every time I look up, the pylon looks so far away.
yeah,
If I just look up like that, I'm losing my efficiency. So I got to put
yeah,
my head back down and swim and get right back in that moment and not let myself get overwhelmed about how far away that pylon looks.
yeah.
Like just get back in the work in the moment, doing one stroke, one stroke, one stroke, and trusting like if I just keep doing these strokes as well as I can, I am going to get there. And I need to check periodically, but like finding that right balance and being able to shift effortlessly between them is like key.
Super hard. Well, and that's that. Okay, so we're just now spitballing analogies, but like that's the power of just like, hey, do I have and so me and so this Australian guy, his name's Angus Bradley. He was my last podcast, and like he really he's super interesting dude. But he's like
Wow.
training just needs to be good enough, and you have to just believe in it. Like
Yeah.
we're very much focused on optimization, and he's like, but optimization is like thinking that you have control over the end result, and really all that you have control over is, and like, this is my other big thing with like stoicism is like the Stoics were basically describing like what we now know as like as neuroscience like 2000 years ago. Like what you think regularly is going to shape your reality, right? Like focusing on the process is what will lead to the outcome. And like we know that to generally be true. And like what I've done it, dude. I read Starting Strength, or I started CrossFit, and I looked at like the outcome that I wanted, and I just wanted it to happen. Like, oh, I'm gonna squat 405 in like 16 weeks because some dude who was probably an outlier did that, and then they skewed the results, right? And where for most people it's just like find what helps you enjoy the thing and do it, and
Mm,
the results will follow. Where most
mm,
people in my experience struggle is they do 3 or 6 months of training, and they actually make a shit ton of results, but they like say, oh, it's not, I didn't get to the end goal. It's like, but you moved
Mm,
6 steps further than you
mm,
were, right? And
yeah.
that's kind of the human experience too, in a nutshell, is
Yeah.
we just
Well,
start to,
it's that, yeah, it's that balance again of like, can I have a thought about the goal, but then like keep at the front of my mind day to day that it's about the journey and the process, right?
yeah,
It's about like the stuff that I'm learning. Cause like all of it can be a good mirror, like when I wake up and I don't feel motivated, like, or I'm having trouble getting started, like that's an opportunity for me to see like, oh, I'm just lacking motivation. And then I can
yeah,
think about what to do about that. Like,
yeah,
do I want to spend time drilling down on that and trying to figure out why my motivation is off? Or do I want to just like notice like, oh, I feel unmotivated and then go get the work done?
yeah,
Like it's all an opportunity to get a better view of like what's going on inside of us, like how are things resonating, what is it? And so it's all like, finding that shifting balance. And so I think like the insight to me is recognizing that that's what's required, setting up practices where I'm doing both of those things and like
yeah,
being attentive to the fact like both of those things need to happen.
yeah,
In the same way that like again, setting the context for anything, if I the question that I lost track of was talking about pain.
yeah,
And so a thing that I've learned in my work is like how essential it is that like if I'm meeting with a patient and one of the identified issues that they've got is pain, is that I want to do a good, detailed pain history to try to get a sense of what this is. Like, is this cancer pain that's like eroding their bone? Is this more musculoskeletal? Is there an inflammatory component? Is this neuropathic pain? Is this multiples of those? Like asking the questions rigorously helps me get closer to that, looking at their imaging, like knowing what I know about their background. But then before I start talking about what pills I'm going to prescribe, I ask about their mood,
yep,
take a detailed history there. I ask about their anxiety. I ask about kind of general what's going on with their stress. I ask about their sleep. And then when we're going to start talking about the plan, I'm educating them about the fundamentals of pain, right? Like how we think of what's like you're saying, nociceptive versus neuropathic, inflammation, like all those pieces. So that number one, that helps to set us, it creates a stage, it creates a framework that like when we're talking about your pain, we're talking about what's happening in your body. Now
yeah,
let's talk about your experience of pain
yeah,
and all the things that mediate that. Because ultimately your experience of pain has to get filtered through your mood, your anxiety, your level of stress, your sleep. If those pieces are messed up, your experience of pain is going to be impacted. If those things are improving, your experience of pain is going to be impacted.
yeah,
And so it cannot be that we're just talking about how much your back hurts
yeah,
because all that's getting filtered through here. A phrase that I really dig is like, I would often hear from patients, especially like in working in psychiatry, they'd be like, oh yeah, I saw that doctor and they just said it was all in my head.
yeah.
And I had
It
this,
sucks when
it's
that
all
is
in my
like
head. It's all in my
that
head.
what people take away, right?
I had this great mentor, Jim Amos back at Iowa, incredible psychiatrist. And I just really loved, he's like that sounds awful, because in the moment it's like I feel dismissed. And
Hmm.
the thing he had this great reframe where he's like, in your head is a really important place where
Yeah,
really important stuff is happening. Like every feeling you've ever had, every memory, every experience, every thought, all that is happening in your head. Your whole experience goes through that space. So for him, he flipped it around where instead of like, oh, it's in my head, so it's not real. It's like
yeah,
it's in my head, it's super important. And we need to be thoughtful about like what are the things that go on in there that are
yeah,
going to impact the experience that you're having. And that definitely informs like the way that I try to approach pain in my practice is that like we have to set it within the context of this person and their life, right?
yeah,
If their loved ones are all sick, if they can't pay their bills, that's like a stress that's on them every day, and that's a tension in their framework, and it's impossible that anything else that feels noxious isn't going to feel that much more unbearable because it's like, I don't know if my lights are going to get turned off,
yeah,
you
dude.
know, or I'm not sleeping,
Yeah. Yeah. I mean, it's so I always go back to I mean, like it's like a Dumbledore at the end of Harry Potter, for which is why the hell did like J.K. Rowling or the whoever it was like, is this all happening in my head? And like Dumbledore basically says like, well, what does it matter? Like it could just be all in your head, and like that's where everything happens. I don't know. I'm butchering that. But like,
That's
I
all
mean,
right.
we're literally conscious beings, right? And
Yeah.
I do hate what people often take away from sort of a pain science conversation, right? Or are trying to understand is that it's okay. So like it's in my head. And really what I want people to understand, it's like, no, it's in your body. It's in you, right?
Mhm.
And you are someone who has like, yeah, if like for me, I'm very wired towards scarcity. Like
Mm.
and I'm trying to change that and being more just generally optimistic about like finances and stuff. But like you kind of look back at your history and it's like, well, my mom and my dad were farmers. One of like my grandpa was like they were relatively poor, and like so there's like this narrative that gets passed down. One of the best things me and my wife ever did for before marriage was when we went through our counseling. It was like do a family tree and see what the like think about the problems that those people had and of what you know
Wow.
about them and just reflect. And it's like, yeah, well, like one of Mary's grandparents was an alcoholic, and like so there was this counter narrative that was against alcohol and that made people feel bad for drinking at all, right? And so you have all these stories, and then those stories get played out every day, right? And they cause you to struggle and to feel stressed. Like I mean, yesterday, dude, my neck, Mary was like digging because I got a headache and she was just digging on my shoulder and it was so tight and it literally like was starting to alleviate my headache. And it's like, okay, what is that? It's like me being an animal and my unconscious brain, my nervous system and my subconscious, like literally fight or flight type shit, right? Where you're like tensing up and like preparing for something and relaxing. Like we see, we can just say relax. Well, what does that mean? It like literally means sit back and just like breathe, right? And do nothing. And like my wife's very good at that. I know this is the next thing I want to touch on is people are wired differently, right? Like my wife is very, very present. She also like does things really slow. And I'm like, get going. Like let's like and it's I said this to him like our battle as parents is gonna be I need you to speed up and I need to slow down, right? We need to like meet in the middle. But like you mentioned that you run anxious and depressed, right? Which is
Mhm.
probably your gift and your curse, right?
Yeah.
And I run high anxiety. I run very much wanting to excel, which
Mm.
also I also just look at everything as waves. And you helped me with this analogy of learning to ride the waves, right?
Mm.
But everything that goes up is going to come down, right? So like you have a very, very awesome vacation and then you get back to reality and it's like, oh, this why can't I just be on vacation all the time? Well, it's like life doesn't work like that, right?
Yeah.
So
Yeah.
I look at it like course corrections quickly and what can I do to course correct. But I also think there's a narrative, and this is why I'm a huge believer in like neuroplasticity. Like I like Martin Seligman, and like or growth mindset or learned
Mhm.
optimism definitely helped me. But it's hard. But do you feel like people can change like their neuroplasticity? Like, can people change fundamentally, or do you think it's just like little bits of tweaks that maybe help people move in the right direction? Do you think like you can take somebody who
Uh,
runs anxious and depressed and they can become like, you know, not anxious and depressed or have that type of thing, or is it more manage it type of stuff? Does that make sense?
yeah, yeah. I mean, I think so my, my, before I got into medicine, my undergraduate degree was in philosophy. So I
Yeah.
love to, and that was what I felt like. I think a lot about one of my mentors in that space, Scott Berman. And he said, he was like, my job, he's like, y'all are good at thinking and you're fast. He's like,
Yeah.
my job is just to get you to slow down
Yeah.
and like unpack the details. So like that, the questions you're asking are like such good, rich questions. And to me, I think what answer you come up with is going to depend on what you mean by some of the language that's in there, like fundamental, right? Like,
Yeah.
is there something that you think is fundamental to what we are? Or do you see us as this kind of like evolving process, right? Like we all have this sense of like internal stability, like our sense of self is organized around like, oh, I think about myself as this thing, but like I'm changing and shifting all the time, right? I might be reinforcing like certain patterns in my brain. I might be strengthening those connections or I might be loosening them, and like we could talk about like how deep into that story I am, but
Mhm.
like there's stuff that's happening all the time. What I observe in myself is that, yeah, like when I'm under stress, I tend to get depressed or anxious, depending on what the stimulus and situation is, but that it goes in a direction that I observe in other people, like that other people don't necessarily go.
Yeah.
And so like what I take away from that is that I think that tells me something about my biology, like the way that my brain is wired, like those are the patterns that I get into. I've been very, very, very fortunate in my life to have access and exposure to ideas and frameworks and relationships that have helped me learn how to harness that and how to
Mhm.
like use that. You know, like you said, the gift and the curse.
Yeah.
Like which one it is just depends on like how you're reading the story and kind of what chapter you're
Yeah.
on, right? Like how is that like for where I am right now, seems like it's serving me pretty well. It still presents challenges to me, but I've done a lot of work. I've spent a lot of time. I've had a lot of people help me learn how to harness those. Because in the end, it's like if the question is, can you change your emotions? Right. The thing I'd say is like, well, we'd have to just observe, like, we don't have control over our emotions. They're going to rise and fall. The waves come. I don't have control over the tide, right? The waves are going to come and they're going to go.
Yeah.
What I have control over is my response, right? So like what behavior I'm going to choose. And that can even just be about my attention, right? The behavior of like, where am I going to rest my attention? Am I going to be totally focused on the anxiety that I have? Or am I going to allow myself to notice that anxiety, make space for that inside of me, and then turn my attention somewhere else, and allow that anxiety to be there and say like, okay, panic, like I see you, I hear you, I feel you. um, but what I'm doing right now like needs to be focused kind of somewhere else, and that
Yeah.
took a lot of time and a lot of reps and afraid like there's having the framework, the logical like mental map, but then there's like the very many reps of like practicing, like being able to like
Yeah.
embody that perspective. So the short answer is, yeah, I absolutely think people can change. Like that's what my work is devoted to, is like helping people find their way forward when they feel like lost and stuck. I observe that that's there. I think it's really challenging. Like the question that I think was the most important for me before going into medicine was, is there a limit to how much you can do for somebody else?
Yeah.
And that I don't know how that question occurred to me, but my feeling was, if the answer is yes, you need to know where it is, or
Yeah.
you're going to destroy yourself trying to cross an unbridgeable chasm.
Yeah.
And my answer was, yeah, there definitely is. And my answer was, when it comes time for another person to make their choice, they got to make their choice. Can you make it for them? You
Yeah.
can try to make it easier for them to make a good choice, right? That's the most we can do for anybody else. And that's, I think, the interesting part of living is like, well, what does that mean? In a given
Yeah.
situation, what is it like? What is the good choice? Who defines what that is? What does that look like? And what does it mean to make it easier? And
Yeah.
so I think it gets back to what we were talking about earlier. Is like, can I go meet them where they are, try to understand what moment are they caught in? What is the narrative? What is the story? Where are they struggling? What's got them hung up from taking whatever their next step is in whatever direction they're trying to go? And then can I be as good as I can be at trying to help them make that next tiny little step, right?
Yeah.
Whether it's for you standing at the edge of the woods with a light, where then you have the opportunity to go, oh, I see there's enough light here that I can see I'm in the woods. I can see I'm a long way. I can see some, I'm out there shining the light, and you're like, that guy doesn't look as freaked out as I feel.
Yeah.
So if I move in that direction, maybe I won't feel as freaked out, right?
Yeah.
But that's your internal motivation. That's your choice. And I threw a couple things out there and was like, maybe give this a try. And then you tried it, and you could see me standing out there with the light. You kept sending texts, and you could see like, oh, I'm closer to where that guy is. And
Yeah.
again, you were sharing with me how freaked out you were, and I didn't catch on fire. I didn't block your number. I didn't tell you, dude, you're fucked.
Yeah.
I was like in there. I was in that moment with you, in the way of being able to like, yeah, that sounds awful. That
Yeah.
sounds really tough. And we can get through it. It can be this tough and we can go through it,
Yeah.
and that was the path for you and me in that moment. And
Yeah.
that's an analogy I think that's applicable to like how I think about my work with my patients is like, can I go meet them where they are and then try to understand where they're trying to go, and also bring my knowledge and my experience of being on similar journeys with other people, and that pattern recognition of like, what are the things that often hang people up here? What are the things that sort of help them? What are the places people are trying to get to? And then like, what can I do in this moment I have with you, whether that's in the hospital in the middle of an acute medical crisis, or in the clinic, where maybe the timeline looks different, like whatever their moment is, can I meet them in that moment, figure out where they're trying to get to, and then look for like, what's the one little step I could help them take right now? Is it adjusting their pain medications so they can have a little bit less pain? Is it holding space for a conversation? Is it helping them like remember their skillfulness or identify what their support network is and then get it moving, so they can keep going?
Yeah. I think one of the things that, well, there's a couple of profound pieces right there, but one of them is like, you've probably identified the line you can go to help someone. And I just think like, something that's coming up over and over again, as me and my wife become parents. And it's like, there's a great John Wooden quote, and it's
Hmm.
like, never do something for somebody that they should do for themselves, and that they
Oh, wow.
can do for themselves, right?
Yeah.
Um, I think there's also a component of that they know they should do, or they know they can do for themselves, right? And um, something that another one of my like in physical therapy school, it might have been like a clinical instructor. It's like the hard part about taking care of people is knowing where the line is for what you should do versus what they should do. Right.
Mm,
So what happens a lot of times, and people do this with their kids, is instead of letting their kid tie their shoes and
mhm,
struggle with it for 30 seconds, they tie them because they got to go
mhm.
fast. Right.
Yeah,
Same
yeah,
thing in the hospital. Right. Hey, they're getting out of bed. They should go do XYZ. And
yeah,
you do it for them because you're in a rush. Right.
yeah,
And you got to
yeah.
get your job done. And that's the hard part a lot about stuff. And like honestly, why I'm doing what I'm doing. I should just say I'm doing it, but it's like I'm just trying to teach people. Like I'm just 5 steps ahead of a lot of the people I work with, right?
Uh-huh.
Same general thing. It's like consistency is gonna trump some BS thing that you find online, right?
Yeah, yeah,
5 to 10 exercises that you really enjoy doing that you're getting some return from are going to be way better than every new exercise that comes down the pipe that somebody's saying is the new great thing, right?
yeah, yeah,
Riding your bike for 30 minutes a couple times a week is going to trump, like, again, something else, right? These simple things that if we can make them fun, because I think riding my bike is fun, you
yeah,
if we can, and a lot of that's just me getting on it and going, and
yeah,
then being mindful of the experience I'm on, right? The hard part is we want the result of the thing.
yeah,
This kind of ties into some other stuff, but
yeah,
it's just how do we help people do things for themselves? Because it's like the best managers don't look like they're doing anything. And that's
yeah,
really hard part about being a manager or being a
yeah,
boss, is like to
yeah,
like just facilitate without like stepping in. Cause then you're always going to have critics who are like, this guy's not even doing anything. And they're like, well, they're actually like facilitating things going well. Right.
right, right,
Um, and that's really hard. And our ego gets in the way of it because we want to take
yeah.
credit for it. And we could get into some Jungian psychology and philosophy but I want to respect your time. So I just like my big last question is
Yeah,
what what are the things that like, I mean, because most of our woes stem from uncertainty, right?
mm,
So for the people listening to this podcast, maybe you're like shaking your head gently, but like I think a lot of it is, for me, dude, accepting death uh
uh,
was a big piece of my journey, and I still struggle with accepting death. I do
sure.
kind of believe in the memento mori type of mindset.
Mm,
But then acceptance and commitment therapy was a big part of like my cognitive behavioral type of journey, because establishing values
mhm,
help me have like little anchors, right?
yeah,
Okay, you're in this situation. One of my values is courage. Okay, what
yeah,
would the courageous version of myself do, right? Um, and then honestly, so much of our struggles just come from, instead of accepting what we're feeling, we turn away, or
yeah,
we say, I can't accept this. Like, dude, pain gets so much easier to manage, especially physical pain, right?
yeah,
Any pain,
yeah,
really. It's probably any pain, when you just accept that you're going through it.
yeah,
And if you can do that, there's probably either you're going to handle it better despite the fact that it persists, or that, just like any form of exposure therapy or graded exposure, you have less of a sensitization of it, you have less of a threat response, and you honestly believing that you can handle something is very, very powerful psychological medicine, right? Or
mhm.
just
Oh,
very
yeah.
potent, right?
Oh, yeah.
But I just ranted on what I think matters. But in your actually trained perspective, what do you think matters?
You're speaking from the training of your life, which is the training that all of us are speaking from. So I don't consider myself at a different level. I have a different set of experiences, but
Yeah,
us comparing notes helps us both get to a deeper place. Like I believe profoundly in that, right? There's a sense in the philosophical traditions of like, just me reflecting on what's knowable versus like, me reflecting on what's observable. And for me, it's like, can we share our notes? Can we do
yeah,
this? Can we talk about from our experience what seems true? You share your piece, and I'm thinking about what is my experience challenge in that, and what does my experience resonate with? And then the part that resonates with me for you that feels stronger, like, oh, I must be onto something because this guy thinks the same. And if I offer something in challenge, then we can both see more of the picture, right? Nobody has the whole picture. We're all working from limited information. I think that the piece about death, yeah, that maybe be to do that justice, we could spend many, many, many more hours. The thing I would say I've learned, an insight that I found really useful from this work is that death is so confronting. Trying to wrap our head around it. It's also literally inconceivable. Like
yeah,
your mind cannot imagine its own non-existence, right? Even in
yeah,
the time that you're trying to do that, you're coming from the perspective of your own point of view. So it's like we can't process it. I don't remember if it's a Socrates quote, but there's one from the ancients that was, if I am there, death is not. If death is there, I am not. As a like, I don't have to worry about it because if
yeah,
I'm there, I'm there, and if I'm not there, that's not going to be a concern for me.
yeah,
What I observe is that, like, if we can actually if we can get through that initial moment of that confronting panic or terror, that existential terror that shows up, what we can observe is that often there's a lot of practical matters around death that we're actually worried about, and there's stuff that we can do about that. Like what I hear from people is, they're afraid of pain, they're afraid of being in pain, they're afraid of suffering and they're dying, they're afraid of leaving their loved ones behind and them being okay. They're worried about specific things that can be addressed. And the great thing is that if you're worried about that, that means you're alive and there's
yeah,
probably something you can do about it. And so the real opportunity is in the part of the value of having a practice that reflects on the limitations of our life, the fact that we will die, that there is an end point, is that if we can get comfortable just sitting in that space, which, as you said, means accepting what shows up and being there, it can actually help point us in the direction of what's most important. So we can get focused on, like, okay, well, I'm here in this moment and that's resonating with me. So let me turn myself toward that and then let me get back to work. And when I'm taking action, I'm much less afraid about what's going to happen because I'm doing the only thing I can control, which is like the action that I'm going to take in that moment.
yeah,
And act, the thing I would step back from, because I find act super potent. That was where I was sharing for you from, when we were
yeah,
talking
yeah,
in that moment, and informs a lot of the work that I do day to day. Is, in the ACT framework, the you could talk about the goal as being psychological flexibility. The
yeah,
observation being that, when people are suffering emotionally, it's usually because there's some inflexibility, and they break that down into these different components. Accepting what's coming, being in contact with my emotions, having a focus on my values, and like using myself as this context, like the different elements of what they call the hexaflex. But those are kind of the capacities that are required to remain psychologically flexible. It ties back to what I said before about being able to remember, like, this story I'm clinging to is just one story.
yeah,
Flexibility is, can I let go of that in a moment that it's not serving me? Can I see the way that the narrative that I'm holding is making it hard for me to move forward, and find another narrative that allows me to move forward again? Whether that's incorporating new information that I was looking at this thing the wrong way, or that I was just fighting, that I was tense and I need to just relax and allow what's coming to come, so that I can then see it more clearly and sort of act, and kind of keep it moving.
dude, I love it. I'm gonna look up the hexaflex. I forgot that concept, but the
Yeah,
psychological flexibility piece. I mean, dude, what really wild? I was listening to Joe Rogan and Jordan Peterson. It literally just came on. I haven't indulged in Joe Rogan in
all
like
good,
4 years,
all good.
but they were talking about Jordan Peterson has gotten very much into biblical interpretation, right? And
Mm,
how it's like they got into how we're just constructing our reality with language, and so much of it is just construct your reality differently by. And I've been thinking about this a lot because we're reading like pre-parenting books, which like who the hell knows what the hell they're doing before they have a kid, right? But Like they're not going to have language for a little while, right? They're going to
Right.
be frustrated, and they're going to, and as people level up their ability to communicate,
Yeah.
their frustration can decrease because they can communicate. And this is a big piece of what we're just struggling with. And I think this country, not to get a giant, open up a giant can of worm, but like, dude, our political situation, like, I don't really like either side of this shit. Like, I think, what the hell are we doing? But I can't communicate that without somebody else jumping down my throat, right? Like,
Mm,
about, hey, oh, you don't, like, you're not participating in our, and it's hard, right? But that's what I really think about more and more, is like, when it comes to maybe my own clients, or you, the better we can communicate, the
mm,
better you can communicate with what you're feeling. And if I can help you develop a deeper lexicon, um,
mm,
and develop a deeper understanding, then you're probably going to move further forward, right?
mm,
But it's because really everything in life, like I said this to another client the other last week. I'm like, you become a better runner by becoming a smarter runner. You become a better lifter by becoming a smarter lifter, or just maybe
mm,
more in tune with what you need to do. Like,
mm.
some people have naturally this gift where they can come squat 500 pounds, and like, we hate those people because me and you are probably trying to think our way through it, where they're just going and feeling it out, right? But they kind of intrinsically have that thing that just allows them to do that, and maybe some gifted potential. But I also think everybody can level up. It
Mhm.
just looks differently for everybody, and that's okay.
Yeah.
That's like what you're talking about, as far as
Yeah.
like our experiences are going to shape us, and that's the cool part about it. And then,
Yeah.
I
Can I get with my journey? Can I
yeah,
be present to it? Can I appreciate, like, this is my story? Like, I wasn't born into a body that naturally squats 500 pounds,
yeah,
right?
right, yeah,
I was born into a body that does certain things with seeming ease, and other things are impossible for me. And, if I can notice that my attention draws to the things that I lack, and I can make a decision about whether I want to keep my attention there, or do I want to try to shift it to, the things that I have, and cultivating my sense of appreciation and looking at what I can do really well, and that's where I think it also is helpful to look outside of ourselves, and be thoughtful about, what do I have to offer. It's not about what I have, it's about what I have to offer. So one frame that I think is useful is like, all this work I'm doing is in some ways in service of getting as good as I can get about hearing someone else,
yeah,
you know making them feel heard. I think, speaking to that profound point I think you're just making about communication, like, my glib comment on a daily basis is like, if communication was easy, I wouldn't have a job. you
dude,
know it
yeah,
breaks down in so many ways, and there's so many ways that we get in our own way. We think we've understood, we break off of our listening early. We hop into the thing, and that can happen for a ton of different reasons. Because our ego is like, oh, I need to have the answer, so I need to jump right in there. And it's just like, everything I'm doing at some level is like, can I get out of my own way to really hear? Because it's like, that's how I'm going to meet you where you are. And if we're going to gain anything at all, we've got to find a place where we have at least some self recognition, which means I need to be really open and listening and bringing myself out, so that you have the chance to resonate with me. And I need to, like, move toward you, right? I need to be listening for you and looking for you, and then meeting you there. And the closer we can get, then we have an opportunity to really learn something, and really grow together, because, we can find a language and an experience that has enough overlap that our words are meaningful to each other. And then we can say, like, okay, cool. So what is this thing? Like, it's the five men and the elephant, right? Like,
yeah,
if you're up there at the trunk and I'm back here at the leg, and we're arguing about what it is, we're not getting any closer to an understanding. If we can realize we're in different places having different experiences, and we're close enough that there's something that's conserved here, and maintain a perspective of curiosity and openness, then we're going to really get somewhere,
yeah,
But it's when
yeah,
I close off, for whatever reason I'm closing off, that I'm closing myself off to that opportunity of connection and growing my understanding.
yeah. I love it. Hey, man, I appreciate this chat. Thanks for coming on. I'm gonna let you
Thanks
go.
for having me. Thanks for
Uh,
having me.
this will be out next week. So, thank you very much, Dr. Alex Gamble. Appreciate you, dude.
Dave, thanks so much. Thanks for your work. Thanks for hosting these conversations and all your work. I think you're putting something really important out there, and I appreciate the opportunity to get to contribute something to the conversation.
Dude, I appreciate having you on, and yeah, we'll have to do it again. We'll just talk. We'll do a whole episode on death around episode 50 or so. How we're, rage against death, but also accept it. That's like my general philosophy.
I love
Appreciate
it.
you, man.
Great to see you, Dave.
Peace.